pregnancy topic of intrauterine hematomas and their impact on ongoing pregnancies. Now, this was a systematic review done, which is very recent, and it looked at the intrauterine hematomas in the first trimester, looking at 1,132 patients with intrauterine hematomas. 9 studies were looked at, and they looked at early pregnancy losses and other complications. So if you have a look at the incidence, it varies between 1 and 39%, and that's very common that we see intrauterine hematomas. In 2011, Tully's systematic review suggested that when he compared 1,735 women to a cohort of controls of 70,703 women, and he found that with intrauterine hematomas, there was a risk of stillbirths, spontaneous abortions, preterm labor, and abruption of placenta. Now, this review, they looked at intrauterine hematomas, which was detected on an ultrasound. Now, when we looked at the results indicated that they saw 6 studies looked at spontaneous miscarriages, and they saw an increase in spontaneous miscarriages in odds ratio of 2.17. Now, and all that was a confidence interval of 95. Studies were looked at, and preterm births also increased when there was intrauterine hematomas present at an odds ratio of 1.83%. Fetal growth was present where 6 studies were looked at, which reported fetal growth restrictions with an odds ratio of 2.33, which is again quite significant. In case of placental abruption, again, the odds ratio was at 3.16 with an incidence of placental hematoma. So if then you start looking at the data that is there, and with, again, we think that mild amount of bleeding exists from 2.8% to 28%, but also it's not that this study has controversies. There have been studies which have shown that a small amount of hematoma has no impact on ongoing pregnancies. And there were in fact 3 reviews which showed that they do not have an impact. This was followed by Tully's paper, which looked at significant impact of intrauterine hematomas and spontaneous abortions, preterm labor and stillbirths, though previous 3 systematic reviews did not suggest that. Now, it was also suggested that the retroplacental clots or fundal clots, which were large, had a negative impact. Now, all these hematomas were before the 14th week of gestation. Now, there has been another review which looked at size of the hematoma, and small hematomas did not seem to have impact on ongoing pregnancy rates, but the larger hematomas seem to have a negative impact on ongoing pregnancy rates, leading to miscarriages. Why do they occur? The etiology is still unclear. There seems to be some separation of fetal membranes from the uterine wall, and that seems to be caused. Now, we believe that there may be some amount of gestational hypertension element to it, some amount of thrombophilia, but we just don't know the real cause. But what we know from this study, again, this study, remember, comes with limitations. What we know from this study is that if there is a significant the risks of spontaneous miscarriage, the risk of preterm labor, the risk of abruption, the risk of stillbirth is increased. But almost all the studies have indicated that the risk of preeclampsia is not present, again, when you counsel the patients. Looking at the variability of studies and looking at no clear answer being there, I would suggest that you should ask your patients to have more regular scans, because 1, it is more reassuring. Pregnant women go into extreme anxiety, and doing these scans may be beneficial.